Hello, my name is Maria O'Donoghue, a midwife working in the labour ward in University Hospital Kerry. I'm here today to talk to you about choices of pain medication in labour. The first one I'm going to talk about is Intinox, which is also known as gas and air. It's a mixture of oxygen and nitrous oxide. The main benefit of it is that you're in control of using it, so you can start using it as soon as you feel a contraction coming, and you breathe it during the contraction, and then when you feel the contraction has eased, you stop breathing it. It takes the edge off the pain. It doesn't take it away completely, but it takes the edge off the pain, and it gives you something to focus on during the contraction. There's no side effects for the baby. For some women, it can make them feel a bit lightheaded and a bit nauseated, which obviously is unpleasant, but as soon as you stop breathing it, those side effects lessen and may go. Ideally, you use it at the beginning of the contraction because it takes about 20 seconds to take effect. So there's a mouthpiece attached to the tubing, and you take long, slow, deep breaths all throughout the contraction. So a big deep breath in, and you blow it out. And you can blow it out through the mouthpiece because it allows the expired air to come out. So it's used by a lot of women in labour, and they find it very beneficial. Another medication choice in labour is an injection of Pathogen. It's a narcotic drug which we give you either in your thigh or your bottom. It may take the edge off the pain. Sometimes it doesn't take away the pain completely. It can make you feel quite nauseated and sick. So at the same time we give the Pathogen injection, we also give you an anti-sickness injection. So prior to making the decision about having the Pathogen injection, the midwife will examine you, assess you, and if the birth of the baby is predicted to be quite soon, then would advise you against having the Pathogen injection and encourage you to use the Intinox until you're ready to have your baby. Okay, another option for pain relief in labour is the epidural. Now, what is an epidural? It's an injection into your back. It's given to you by the anaesthetist, who will get your consent beforehand, having explained the procedure to you. From their point of view, it's very important that you stay very still during the procedure, and you need to get into a certain position where you'll be crouching down. They will give you an injection of local anaesthetic into your back, the same anaesthetic you'd have if you attended the dentist. So a tiny tube then is inserted into your back, through which drugs will be given to you by the anaesthetist, and the epidural continues for the duration of your labour. On some occasions it doesn't work, or it may not be very effective and may need to be recited. One of the side effects of you having an epidural is that your blood pressure could drop. So prior to commencing the epidural, we need to put a drip in your hand so that you're given fluids through that. Your blood pressure is monitored quite frequently during the epidural. You will need to remain in bed because your legs are quite numb. There's minimal side effects for the baby. The one disadvantage of the epidural is that towards the end of the first stage of labour, when you're needing to deliver your baby, the sensation to push may be reduced, and you might need to have assistance to have your baby from the doctor. It takes about 4 to 6 hours to wear off once the baby's born. We're here to provide you with all the information you need to make an informed decision in relation to the right medication to use during your labour and the birth of your baby. It's your choice, and we're here to support you.